So this video we're going to look at intravenous fluids and mainly looking at setting up this here. This is the giving set. This is, yes, it's a paramedic skill. It'll be paramedics that will be cannulating our patient and putting up IV fluids, whether that's through glucose, paracetamol or sodium chloride itself. These are the three main drugs that will be given through the giving set there. So with all drugs, if you are assisting the paramedic with this, or you've done your safe administration life-saving medication course, then with all drugs we make sure that the drugs packaging itself isn't damaged and that everything is in date. And you should really be looking at checking this with a colleague as well. So here we have some glucose, it's 10%. It is in date, it's August 2026, and to me it looks like all the packaging is very much intact and the liquid is nice and clear. It's the same with the sodium chloride here, it's in date 4/26, and the paracetamol. So what we'll do is make sure that we're administering the correct drug with our paramedic. So if they ask for IVP, intravenous paracetamol, that we have here the right amount of fluid and volume, so it's 1,000 milligrams in 100 mils of fluid. Be very careful with the sodium chloride and the glucose. Obviously they look very similar. If you are under pressure at work, it is very easy to give the incorrect drug if you shortcut your safety checks. We do at Elite Medical, we do stick these 10% glucose stickers on the bags. This is to really try and eliminate any mistakes being made, and it just highlights that this is glucose as opposed to this is sodium chloride. Just be aware that these stickers may not be stuck on, so always check. Now, drawing up fluids, we are going to require a giving set. With these, you open up the packaging, never easy to get into. So open up the packaging, give it. And my advice with these would be to keep it all nice and curled up. We don't want it falling certainly onto the ambulance floor. Now, when these come out of the packets, you'll notice that this is the wheel lock here. This will clamp off the cord and it can run up and down the tubing. Now with this, they will always be packaged with them open. This is to prevent the wheel here squashing on the tubing and denting that tubing, making the flow rates inaccurate. So they will be opened up. The very first thing we're going to do is we're going to close that wheel down. So we clamp that off, so you'll see it wedging down onto the tubing there, completely occluding it. We're also going to have a look at the tubing, making sure that during its sort of time in the drugs bags it hasn't been squashed and damaged as well. We're going to have that ready to go. We're going to open up our drug that we require. We're going to be checking with our paramedic, checking with our colleague that is the correct drug, it's all in date. And we're going to be placing the sharp end of our giving set now into our drugs bag or fluids bag. Now it does have two ports here. This is used predominantly more in hospital situations where they will inject other drugs into this. So let's say we want to give some IV glucose with an antibiotic in there, they can insert that drug into this bag. We're not going to be using that port here, we're going to be looking to use this port. So we snap the safety cap off, we remove the sheath from the sharp, and without touching that sharp, we insert this directly into the bag. Now just gently twist and insert with the bag, ideally upside down, and fully insert, just making sure the sharp doesn't come through the edge of the bag there. Once we've inserted, we invert the bag, and you should notice that no fluid will come through. We have our tap turned off. If this weren't turned off, it will automatically run through, and you may find you get air bubbles coming through on the tubing. We're going to squeeze the bag, and we want to squeeze the bag, this port here, just till we get to about 50% full. There we are. Now you'll notice that this tubing has air in there. We haven't cleared the line yet. So we now need to open up the port, and you should see the fluid run down through the tubing and right to the very end. So around it goes, and we have a few air pockets in there. That's absolutely fine. But you'll also notice, oh, it shouldn't do that. It has. It shouldn't run out at the end. If it does, it's not a big problem. So once we've got all the fluid through, we've primed our tubing here, it's all ready to go. If you do have any air bubbles in there, let's say there's a couple of air bubbles, if you straighten the tubing and give it a little ping, you can work those bubbles to the top. Now, best practice is not to have any bubbles in the tubing whatsoever. So once you've got rid of all your air bubbles, you can, if this was hanging from the roof of your vehicle, you can connect the end to the port there, and you can hang this up. There it goes. Sorry, there's a little clip on the side there. So you can hang that up on the roof of the ambulance or on a giving set, and that is ready for the paramedic to take and to connect to the patient's cannula. So connection will require, it's a little lure lock on there. Here's the cannula. They will remove the cap. Ooh, there we go. They remove the white cap. Having the tap turned off, they will insert the lure lock to the end of the cannula, open the tap, and we should now run fluids through. You will notice fluids are running through as they come out the end of the cannula there, and that'll be going obviously directly into the patient. There may be occasions where we have swan locks attached to the end of the cannula. So if we are going to be applying these need to be attached first prior going onto the cannula. We cannot attach these as these are full of air, so they need to be primed. So to do that, we have a number of options. We could take one of these flush syringes. We can push, this is another lure lock. So we push and we rotate a couple of times just so that thread bites in, and then we are going to gently just squeeze the drug through. Squeeze the drug through until it comes out at the end there. So we now have that fully primed. You can now remove this and it will not take in any more air. We can remove the safety cap on the end. We can have this then attached to our cannula. Again, it's just another couple of turns on there, and then this can be connected to the end of our giving set. It just means if we're going to put maybe up a second bag of fluids, it's just a nice easy connection going through. Each time we reconnect, we go over with an alcoholic swab just to make sure the end is sterile before the new connection comes in to contact the patient. If you are using a syringe that has a smooth tip to it, it doesn't have the screw. With these, you can forcibly push them in, give them a little twist, and they do bite. There's a little barb in there that will hook onto the syringe. It will bite. You can then inject your drugs through, or the paramedic will, and they will just give it a little twist, and as they twist, it pushes back out, locks off, so no fluids come back out. And that is how we're going to be administering fluids through an IV giving set. One golden rule, however, is what we call double spiking. So now this spike here is in this bag, the pressure here is negative, and it will push all the fluids through the bag. If we are to remove this, it will take air into the bag and we'll get a positive pressure. If we were to put a second giving set into a bag that's already been spiked, the air pressure can push fluid through and it will follow through with the air. This can lead to pushing through air embolisms into a patient, which can be fatal. So once a bag has been spiked like this, we are not able to remove this spike until the fluid has either gone through or it's being disconnected to the patient, and we never ever reinsert a second giving set into a bag of fluids like this.